lecture 1. And just as you said, we are going to seek to explain the history of public health and then also describe the historical and theoretical foundations of public health. And then finally, we shall explain the concept of health. Okay, so when we say health, what does it mean? Now, notice that each individual group have the way they define health. Okay, have the way they define health. Now, we all can define health in our own small way. So many people put that explanation or understanding under the common sense views of health. We can have the negative definition of health. We can have the positive definition of health. And we can have organizations, how they all define health. Now, but principally, it was derived from an old English word called hail, which means whole or to make whole, with the understanding that once you are whole, you principally do not have disease condition. Okay, so your integrity, your soundness, your well-being is whole, you are complete. Now, we have common sense views of health as you may define within your context, as I may define within my context. We are saying that different societies and different groups within one society may have different views on what constitute their common sense notions about health. When you come to Ghana, we have various tribes, various societies. You go to them and ask them of their health, they'll tell you. Okay, even you, your definition will be different from mine. Okay, so that is the common sense views of health. And usually when you are asked about health, we usually do not state our common sense views. Now, we have the negative definition. And the negative definition is simply the absence of disease or illness. Okay, so when I don't have any disease or I don't have any illness, then I have health. Okay, so sorry for that. Come. Can be. So someone will say, "Oh, doctor, I am feeling that." Doctor, I check everything. You are fine. Is that doctor? I'm not fine. I'm not. So like that. So illness is subjective. How you feel, disease is what is seen. Okay. Then we have the positive definition. The positive definition, we say, is the state of well-being that is interpreted by the World Health Organization, okay, as a state of complete physical, mental, and social well-being, and not necessarily the absence of disease or infirmity. Okay, that's the WHO's definition of health. Okay, a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So to say you are in health, you must have complete physical. Your physical constitution must be intact. Your mental state should be intact. Oh, you didn't greet me. You didn't greet me. Okay. Welcome. Okay. So you must have physical, your physical state must be complete, your mental state, your social must be on point. Then you can say you are in health. And per this definition, I don't know who we can say is healthy in this world. I don't know. Okay. Now let's look at some other definitions by WHO. Okay. In 1984, they came out with this definition that it says the extent to which an individual or group is able, on one hand, to realize aspirations and satisfy needs, and on the other hand, to change or cope with the environment. Health is therefore seen as a resource for everyday life, not an object of living. It is a positive concept emphasizing social and personal resources as well as physical capacity. So this is how expanded the WHO came out with about health. Okay, so your everyday life, it is a resource. It is not something you merely need. I mean, it must stay with you. It must define who you are. Okay, and that is WHO, the expanded version that they have brought. Now, some other definitions by churches, medical commission, World Council of Churches, and all that are saying that health is a dynamic state of well-being of the individual and the society, of physical, mental, spiritual, economic, political, and social well-being, of being in harmony with each other, with natural environment, and with God. In fact, I love these definitions so much, except that, they have brought in economic, even though it is true. Sometimes, as a man, if you have nothing in your pocket, your brain doesn't even function as it should function. And then you are thrown into a certain state. I remember a certain woman who was very sick. She has gone to the hospital, received treatment, but things were not that. So she was just at home. And news was brought to her that she cast lotto and then she has won 10,000 Ghana. That day, that sickness ran away. So all that she was suffering from was money sickness, economic. Okay, so Council of Churches, they are having a very wide view of health, and I think I side with them. Okay, I think I side. Is it physical, mental, spiritual, economic, political, and social well-being? So, with this explanation, who can say he is in health? That's a thousand question for all of us. Now, let's look at well-being because it features in the definition of health. Well-being, the term well-being, what does it mean? We say it is a term widely used to describe what makes a good life. What makes a good life? Okay, it is also used in healthcare discourse to broaden views on what health means beyond the absence of illness. So, even though you are not feeling anything in your body, okay, even though you are not feeling anything in your body, Charlie, there are certain things you need that you are not getting. You need something but you are not getting, and sometimes the way your brain, your mind will do you, only heaven knows. Okay, so well-being goes beyond the absence of disease. It goes beyond the absence of illness. It just defines what makes you, or what makes your life good, or what makes you feel that your life is good or will be good when you get it. These are all well-being. Okay, so feeling good and functioning well are seen as important component of mental well-being. Okay, and then it is in turn leads to better physical health, improved productivity, less crime, and more participation in community life. That is very true. Okay, once you feel good, you are not going to think a lot about a lot of things which may impact on your overall health. Okay, Now let's move on. If there's any question, please you can prompt me. Okay. Public health is quite very lengthy course. Now, there are 5 functions to improve personal well-being. There are 5 functions to improve personal well, and the first is to connect. Okay, is to connect. So human beings are social beings. We are not, isolatory beings. We are social. You get in touch with the family, you get in touch with friends, you get in touch. Persons, that because we are social beings, and by doing so, you are able to stay away from a lot of mental health diseases and all that. You have to be active. Okay, your physical nature, your physical nature is paramount. Your physical nature is paramount, so you have to be active. You don't have to be sedentary in lifestyle. Okay, so there are some people work to home to work to home to like that. It, they, their life is just sedentary. Okay, so you have to be active in other things too. Yes, Mr. Gabriel. Okay. Yes, Mr. Apia.
Hello, sir. Yeah,
Yes.
I'm not getting some clarity. I want clarity in this place. When you say sedentary lifestyle, giving an example of from house to work and work to house. I'm a little confused with that example you gave. Can you please make it clarity a little?
Okay. Explanation.
That
Yes. Okay. So that's fine. Yes. So sedentary living is one thing that I think we have to really avoid. Okay. Sedentary living is it's how do you even say that in our local language? So essentially, you are not active at your home. You are either sleeping, sitting watching TV, or holding your phone watching or on social media. From there, if you are going to the work, home straight to you go and pick a car to your workplace. Even at your workplace, you are sitting down. The work we are all learning it is sitting work. Oh. You have to sit and consult. You have to sit and consult 6 hours, 7 hours, 10 hours, and all your back will be paining you, and like that. From there, you are even tired. You can't pass anywhere. You have to go and sit in your car, put on the air condition, stay in traffic, and then you get home. Once you get home, you are tired. You bath, you eat, you sleep, you wake up the next day, get into your car to the work. That is sedentary. That is sedentary. You are not active. In fact, if the nature of your work cry was, moving, you move here, you move there, you move there, that is fine. But the truth of the matter is, a human is predominantly. Okay, so you have to incorporate a lot of things in your daily activities so that your life doesn't become sedentary. Sedentary living brings a lot of things. Back pain is number one. Lower back pain. Man for be braces young, yeah. Okay. I hope Mr. Pia, you understand now.
Yes, sir.
So you have to be active. The third one, you have to take notice. You have to be aware of sensations, our thoughts and feelings. Okay, you just have to be aware. If something is, coming up in your body, you should be able to note that this is not normal. I have to do something about it. You have to take notice about. They say in Ghana here, unless the disease unless you want to wake up from bed and you can't wake up. That is why we remember there's a place called hospital. Other than that, yeah. Okay. So these are all some of the things you have to take notice. We have to also give. God did not create us to hold on to a lot of things. We have to give it away. You have to learn to give. The more you give, the more you see that your well-being is, I mean, getting, you will feel happy about when you are not happy when you give to people. Then it means that there's problem somewhere. So you learn to give, you learn to make others happy, you learn to make others say thank you and all that to you and all that, and then you are good to go. It enhances your well-being. That is what the Bible tells us. Okay, so we keep learning, we never stop learning. One thing is we have to keep learning every time, every day. Okay, so it's very important for cognitive development. Sister Mercy, you want to talk to me? All right. Now let's move on. It's 3:31. I started at 4. I started at 3. I had to finish at 5. I'll try. Public health. It contains a lot, but I'll try. So now let's look at some of the disease. Now, sometimes we interchange the concept of disease and illnesses. We interchange them. Okay, but they are two different things. For example, when we talk about disease, it is derived from a word called disease, which means uneasiness or discomfort. Okay, so modern disease implies an objective state of ill health. Okay, which may be verified by accepted canons of proof, which are couched in language of scientific medicine. The year can you say, if you have a disease, it must conform, it must be able to what meet the accepted outline, the accepted scientific principle. For example, if a doctor says you are okay, okay, I think Auntie Mercy, your mic is unmuted. Okay, so if you go to the hospital and from verifiable all the history taking, all the verifiable this one, and then they come out with and say they found pylori bacteria and probably you have stomach ulcer or you have peptic ulcer, then that is a disease. Okay, that is a disease because it meets a certain threshold, it meets a certain standard that we know in scientific circles. Okay, that is the disease. How about ill health? Now, ill health is an umbrella term that is used to refer to experience of disease plus illness. The experience of disease plus illness. Okay, so thank you. So it when you are when we say ill health, we are combining both disease and illness. Okay, so for example, when someone reports symptoms and further investigations such as blood tests prove a disease process, the two concepts of disease and illness coincide. In this instance, the term ill health is used. Are you getting it? So someone must report something that he or she is feeling. Then going through the standard procedure, we come out with what? A certain verifiable outcome. Then once we are able to corroborate what we saw and what the person is saying, then we say the person, that term is what? Ill health. Okay. Illness, on the other hand, is subjective. For illness, it is subjective. It is what you are telling me you are feeling. Okay. what you are telling me you are feeling, and that is what we call the symptoms. Okay, what the person is telling you is symptoms. What you are seeing on the person is signs. So the symptoms the person is saying, if only it meets our verifiable standards, then that is ill health. If the person is complaining of something and you try all that, you try and go into your differentials and still you are not seeing anything, you can't say the person has any disease. So it becomes an illness to the person. Even if the person feels something, you are not seeing it clinically. Okay. So it is possible for someone to experience no symptoms or signs of disease, but to be labeled sick as a result of medical examination. You know that someone can, it happens. I have come across a lot of things. Some people can bring their relatives to the hospital, their wife, their children, their this one. So once I'm here waiting, why don't I go through this and then do a lab checkup? The person starts at the vitals. We check the BP and it is 180, 190. So you know the one who came with a patient cry is sick more than the one who you say is sick. Okay, so sometimes you can be absent in illness. You don't feel anything. But in reality you have a disease. The same way that you will feel an illness, you will feel a symptom, you will feel something in you, but you go clinically we don't find anything. Okay, it is still subjective. And these are the people we call malingers. Okay, malingers. They go to the hospital, they complain, the doctor does a lab, does a scan, does x-ray, does everything, and doesn't see anything. The person too is saying he's sick. Sometimes the doctor will tend to say, well, I think maybe the person is just lying, or the person just want to dodge something, or the person, okay, all these things are there. So we label them malingers. And this is one of the key areas that we as naturopaths must be concerned with. The reason is simple. For such individuals, they may really be suffering, but because it doesn't meet the biomedical model of what disease establishment, we tend to say they are not sick. Meanwhile, they may be sick. You get it? Meanwhile, they may be sick. So we move beyond the biomedical model and then understand the cultural and factors surrounding the illnesses and all of them. Okay, so that is it. Okay, so the consequences of malingers is that a sick certificate, okay, or a sick pay may be withheld if a doctor is not convinced that someone's reported illness is genuine. You have asked for permission from your facility, from the hospital, your where you are, that you want to visit your doctor and that you are not feeling fine and all that. And then you come and then you are not bringing in medical report because the doctor doesn't see anything. Meanwhile, you are complaining. Okay, so it may turn out to be that maybe sick pay or this one may be withdrawn and all that. Okay, so that is how the system has been designed, has been programmed. But thank God naturopathy is in now. Maybe one day, these views may change. Now, any question for me whilst we go on? If there's any question, please bring it up. Okay, if there's any question, bring it up. Now, the concept of health is not only physical. For example, an individual you see here has his or her emotional aspect, has the physical, has the mental, has the social, has the sexual, has the spiritual. All these things come together to make an individual. Okay, so when you tend to concentrate solely on the physical, because I did this, I didn't say this, it becomes problematic. Now the world has accepted the mental and the emotional too. Okay, mental and emotional too have been accepted. but the social, sexual, the spiritual, it has not come out well. Okay, many do not know that. Uh, let me even go on before I put myself in trouble. Okay, so we have the core views of health. Just as we've looked at um, the medical fraternity, we've looked at the spiritual, the churches, what kinds of churches and all that. We also have cultural. So the cultural views, now, some can explain and say there are imbalances in the natural harmony of nature. Okay, so when you go to traditional Chinese medicine, they will tell you that there must be a harmony between the yin and the yang. Okay, yin and the yang. When there's disharmony, there's disease. Okay, so we have cultural views of health. Okay, imbalance, disharmony. Okay, disharmony. Then you have complementary therapists who offer therapies based on these cultural views of health and alongside conventional model. Okay, so the conventional settings decided that okay, all these things we can look at some and then they will be our complements. We call them complementary medicine or complementary this one. That's how come we label them like that. They don't know some views are rooted in cultural this one. So there are complementary medicine, or there's nowadays they are being incorporated so well in the mainstream medicine. Okay, so that is that. Now, in conclusion of our concept of health, we are saying that the medical model has dominated thinking about health, yet its value for health promotion is limited. What does it do? It relies on a concept of normality that is not widely accepted. It ignores broader societal and environmental dimensions of health. It ignores people's subjective perceptions of their own health. Okay. And then it focuses on pathology and malfunction. Okay. So that is the biomedical model. That's the medical model of health. Naturopathy is to bridge that gap. It takes from the this one. Brings them inside and as medical system. Okay, so that is it. At this point, is there any question for me before I move to the next concept of public health? Yes, Mr. Apia. Oh, okay, it was a mistake. Okay. Now we are moving to public health. There, do your homework. Okay. You are moving to public health. Now that we understand health and disease and illness, okay, we are now going to what public health actually is. Now, Winslow's definition is a comprehensive one, but usually when you are asked about public health definition, we usually focus on one called Atchison. Okay, called Atchison. Notwithstanding, we'll try and see what Winslow's definition of public health is. And it says, it is the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts for the cleanliness of the environment, the control of the community infections, the education of the individual and the principles of personal hygiene, the organization of medical and nursing service for the detection and preventive treatment of disease, and development of social effort, which will ensure to every individual in the community a standard of living adequate for the maintenance of health. Winslow, 1920. Baby. So let's go to Acheson. In fact, let's go to Acheson. Now, Acheson summarizes it, okay, and says it is the science and art of preventing disease, promoting health, and prolonging life through organized effort of society. Simplicity. So, when we talk about public health, we are essentially looking at preventing disease. That is one. Promoting health and prolonging life. That is two. And then we do this through organized effort of society. So you see the difference. When we talk about public health, we are talking about group, society, and not necessarily individuals. Okay. So we are going to go into societal norms. We are going to go to cultural settings that we have across the world, across the globe, and we shall take some special look at our settings here in Africa. Okay. So principles of it is rooted in what? Participation. You do your side, I do my side. You will not do your baller and come and put it on my environment, or you not do your baller and go and burn it in the night when I am taking a nap in the room, when I want to sleep and dream that Angel Gabriel has come to give me good dreams, and you are burning your rubber, your rubbish, your baller, and it is entering my room. No. So you do your part, I do my part. That is participation. Equity. We are all the same. Collaboration, we do it together. First, it was there in the olden time, the 90s, but these days, we shall them, we shall meet them. Then we are going, you are in your room, I'm in my room. Even the wall that is the separating us is like the wall of Jericho. Very tall. I can't see you, can't see me. Okay, so let's go. The concept of public health. We are saying that it can be conceptualized as analyzing the health of a population and the threats it faces. We are conceptualizing it too. So we analyze the health of a population and the threats it faces. When you come to Africa, let me even use, I've not gone to every part in Africa. I've not even gone anywhere. It is Ghana, I know. So you look at some places, the disease condition that is prevailing there, okay, may be different from another part of the country. Okay, it may be different from another part of the country. So we access that population and the group in that society, in that population, their health and their threats that they face. Okay. Then secondly, we say it is a science of protecting the safety and improving the health of communities through education, policy making, and research for disease and injury prevention. Now, you see, what with public health, it's all about education and policy making. Okay, the research is done, it is analyzed, and then policy is derived, education is given. Okay, education is given. There is a community that I learned of. For that community, they are saying that, how do they even call this? They need natural air conditioning when they are forgiving, when they want to ease themselves. Okay, so they don't like enclosed area. Our washrooms from today, it is, and we'll do our blocks and go and put toilets in. No. They just prefer the open defecation. They just want to dig. As they are doing it, fresh air will be blowing around them. And they are good to go. Okay, so that is it. That's it. One community. Okay, you get it. And then they won't have to. They say they don't want to be constricted, so that they'll be smelling their own this one in the same room. What kind of thing? They don't like it that way. They prefer free range. Okay, and it's problematic. Now, another conceptual this one is that they identify causes of disease and disability and implement large scale solutions. When COVID-19 came, you realize that policies came on board. They say we should do contact tracing. They say you should wash our hands. Now you don't even shake your friend's hand again. You don't do this. All these are public health concerns. Okay, all these are public health. And another conceptual framework is what is to prevent disease and injury. Is to prevent disease and then injury. Okay, now these are examples. Okay, so instead of treating premature or low birth weight babies, factors affecting it are studied and programs developed for its prevention. So we don't wait for you to deliver preemie. Then another is, instead of prescribing medication for hypertension, the links between obesity, diabetes, and heart disease are examined, and the data used to influence policy aimed at reducing. So this is it. So instead of waiting to describe your design your anti-hypertensives, don't let me mention them before I'm summoned before a committee. Okay, so what we have to do is to examine the linkages between obesity, diabetes, and heart disease, and then design policies that will help tame the tide of hypertension increases. So public health microbiologists to work to find vaccines. Now they are doing so well. We have a lot of vaccines. The time that, in fact, infectious diseases were worrying our great grandparents, now we have vaccines. That has helped a lot, even though they have their side effects. At least it has helped a lot. Okay. Then we have behavioral scientists who will find ways to discourage populations from smoking. Okay, even though the ganja man will not listen, at least they try to keep it that it will spoil your liver, it will do this, it will spoil your heart, it will do this. The ganja man on fire. So that is that. Then we have environmental scientists who work to discover foods that prevent cancer, even though every day they are bringing some for us to eat. Health policy analysts evaluate health insurance programs and make recommendations. Okay, that is that. Nowadays, mobile phone, this network, they will do insurance for this one. When you are sick, we'll do it. When you are sick, we will come and help you. Someone told me that he did it 3 years. He fell sick and they gave him 25 cedis. So what? I will stop. I will not do again. It's not easy. Then we have epidemiologists, okay, those who study pathogens and all that. Okay, they identify trends in health and illness, looking for links, causes, and interventions in areas such as HIV, tuberculosis, etc., etc. Okay, so these are all public health fields, public health that were areas that we'll be looking at. We rather prevent and not wait for it to happen before we do justice to it. Now, components of public health. We have the epidemiology department, we have biostatistics, we have management of health services, we have environmental health, community health, behavioral health, health economics, public policy, mental health, occupational safety, gender issues in health, all of them, blah, blah, blah. Plenty. Now, public health comprises a lot of areas. Now, what is the focus of public health? Okay, what do we look at? Rehabilitation. So the combined and coordinated use of medical, social, education, and vocational measures for training and retraining the individual to highest possible level of functional ability. So we try and then re-educate the person. Oh, especially in the prisons, it is done so well. You need this thing that it doesn't help. Why don't you learn this? Why don't you learn farming? Why don't you learn cultivation of maize? Okay, why don't you learn dressmaking so that one day when you are out, you can do this? Okay, then some people, they were this. They maybe you meet a footballer who got his ankle injured and never was able to play ball again. the person is highly traumatized. What can you do? Okay, why don't you go this? Since you are skillful in this, why don't you upgrade here? So all these things are rehabilitation, this and that you can also do. Okay. So we have something called salutogenesis. Okay, salutogenesis. So what we do in salutogenesis is simple. We say it's a medical approach that focuses on factors that support human health and well-being rather than factors that cause disease. Okay, so what are the things that really help individuals that can really aid you to do things? And that is salutogenesis. We don't really focus on this will harm you, this will harm you, this will harm you, this is good, this is so no. We rather focus on the things that will support you and we keep you going in that area. Okay, so that is the focus of public health. Now let's look at some of the activities of public health. Okay, we prevent epidemics. Okay, we protect the environment, workplaces, housing, food, water, and all that. We monitor health status of a population. We mobilize community action, respond to disasters, assures quality, accessible, and accountability of medical care. We have links between high risk and hard to reach people who need our services. We have all of them detailed down. There are some villages and this one when you are going to have to cross river. Sometimes it's not easy. So research develop new insight and innovative solutions, and then leads to the development of sound health policy and planning. We are doing all this, but our world is still going to a certain direction. Okay. We are done with this one. We are moving into another field. Is there any question for me? Okay. So let's go to the history of public health. The history of public health. We are saying that we were searching for the origins of public health and health promotion in the earliest civilizations. Okay, we looked at the writings of the Babylonians. Sorry. The writings of the Babylonians. We went into the Egyptians. We considered the Old Testament Israelites. Okay. Now, some of the things that served as indications of various health promotion techniques. Okay. We have shelter, we have food, we have water, and then safety. Okay. And these were in community systems. Okay. Some we learned of how rain is collected. Others we have how people got safe drinking water. So all these factors came into play when we were searching for the history of public health and health promotion. Okay. Then we looked at, it says there were various sewage disposal methods, including the use of earth closets. Intoxication was recognized as troublesome. Dietary restrictions were numerous. Various sanitary restrictions governed the supply and preparation of food. That in some places, building regulations were set and street cleaning and garbage removal began to occur regularly. Okay, mental health and spiritual health were advocated. In most early civilizations, okay, health and religion overlapped, and that is the plain truth. In most early civilization, you could not decouple health from religion. They were one, because there are some individuals you would have to convince them superstitiously before they are able to do what you want them to do. Okay, so even our some of our traditions we came to know. Okay, they will tell you a lot of things, even though what they are saying is scientific, but they were not saying scientific then. Just that they will scare you a little for you to be able to do what they want you to do. Okay, and that and that is it. It says organized religion sponsored many of the earliest healthcare facilities and practitioners of the healing arts. Okay, in some civilization, the first temples were also the first hospitals. In some civilization, okay, personal hygiene were advocated, exercise was taught and practiced. Okay, this began some of the histories. I mean, even before we were able to put a lot of things together. Okay, so histories of public health show that some form of collective health measures have always been implemented by society. Okay. So even with the history that is written for us, I mean, humans have lived for nearly 6,000 years, if not more. Okay, and so when you come and give me history of 3,000, 4,000 years ago, I won't take that as the entire, because public health has existed ever since humans have ever lived on this earth. Okay, so some of the examples include the Roman public bath, Roman laws governing burial of the dead, and regulating dangerous animals and on. So all these things were what were done. Okay, isolation of people with leprosy, even it was done in the ancient Israel. Ancient Israel, it was done. Okay, until you were well. Now, we are going to look at this history within the context of 5 important historical periods. All this history, we are going to go through 5 historical periods. The first is the Greco-Roman era, whose emphasis is on water and sanitation. The second is the medieval era, whose focus is on endemics. The third is the Enlightenment era and a focus on disease prevalence. The fourth is the industrial era with focus on working conditions. And finally, we come to our era, the modern era, with a focus on bacteriology and then biology and all that. Okay, so let's take a dive into these important historical periods. Before we go, let's go at the prehistoric era. We are saying the prehistoric era, the agricultural revolution saw the expansion of the population and consequently the development of settlements, villages, and towns came to play. So the people used to say that is the hunter-gatherer time. So they were moving, identifying new settlements and all that. And because of agriculture, people were, looking for better lands, lands that were supportive of their farming, and then as they were moving, new settlements were being created. Okay, so another thing, that hot summer months were synonymous with the putrefaction of debris. Yeah, so even these days, during the hot weather, when the sun is shining, you go and bring your ntoma that has been in your boxer, that scent is coming inside to come and dry them. So all these things, all these things are public health. This one, you see. So these things began in the prehistoric era and all of that. Then we came to the Greco-Roman period, okay, whose emphasis was on water and sanitation. We are saying that the Greeks combined dietetics, medicines, surgery, and regulating the whole lifestyle in their treatment of ailments. Okay, so diet or dietary regimen in the broad sense of the whole lifestyle was the first resource. So for that time, if you are sick, the first thing they look at is your diet. How can we incorporate a lot of things, certain things in your diet to make you well? What should we take out of your diet to make you well? So they came with the concept of sanitariums. Okay, now you have hospitals that you go and then you take drugs. So, but it shouldn't be. We have to design something like sanitariums. Sanitariums, you go there and holistically you are taken care of. Okay, your diet is seen, your physical activity is seen, and all of that. Okay, there are some people for they sign contracts, like when they are entering into a new week, you sign a contract that this week, 7 days in a week, I'm going to bath 2 days in a week. And even with that one, it should be in the morning, or else if I bath in the evening, then what is the need to bath in the morning, especially when I bath and I go and sleep and I didn't go anywhere? Why should I wake up again and still bath? You want me to become slim by peeling off my skin? You know, it's there. Okay, so we look at all these things, and then in Greco-Roman era, they designed it. So it wasn't the hospital we find today. It wasn't the hospitals we find today. Okay, even the sanitariums were situated in certain positions, certain places that everywhere you turn your eye, you see green. The leaves were living green. Okay, and the pure oxygen you'll be inhaling, and even this one the plants were emitting that they all help. But today, look at where Kolebu is situated, and then the Kole Lagoon is there, and it's not easy. It's not easy. Okay, so that was then. Then during that period, we have training for the army and athletic competitions, such as the Olympics. Okay, similarly focus on regulation of food and drink, exercise, bathing, massage. All these things were there when they were going to Olympics. You know, the Greeks, they brought a lot of sports. In fact, sports, many of them came from the Grecian period. Okay, so they regulated their food, then their drink, the exercise. There was a guy that was going to do 4x4 relay or 8x4 relay. I don't know what they call it. This guy was very good in running, but that day, the way he was running, and they were it. They go. He was taking the lead down to him. Then one person will pass. Him, another person will pass. Him, another person will pass. He realized that he was taking the last position. He looked into the people standing there and he had to run away. They asked him, what happened? Say, he eat banku and pepper. He grind pepper, hot one, and then with this one, how can you run? Okay, so chairman was last, and I don't know if it is if they are still waiting for him to come back. Then they have to reconsider this one because chairman has dodged. Okay, so that is it. So they were regulating their diet, they were regulating their food, their drink, exercise, bathing, massage. Okay, all these things were regulated. Okay, all these things were regulated. Surgery during the Greco-Roman period was the last resort. It was the last. After they have gone through everything and they realize that it did not work, then they have to consider surgery. But today, surgery is considered the first resort. Okay, so even surgical skills, it was developed on the battlefield. It is when you go and then you see that you have no doctor around, or then you have to develop something to do. I mean, that is how things were. Okay, in fact, the situation we find ourselves in wasn't there until about 1930s, 1940s, when the miracle pill was identified. Penicillin. You take it and your pain goes away. What kind of medicine is this? Then everything began changing. So that is how it is. Now we came to the medieval era. Okay, medieval Europe, and their focus was on endemics. Okay, so medieval towns were unhealthy places. I mean, slums all over. I mean, you see, they didn't have sewage systems like I see these days in some portions. Those who have money that they can build their houses, their washrooms, their bathhouses, then they'll connect their sewage out. Okay, so you are walking the street, you are seeing sewage, someone. So all these things were part of the medieval Europe. Okay, houses were full of rats, lice and fleas. If you still have rats in your room, then you are mimicking the medieval Europe. Okay, So we have to do justice to it. Okay. Then, in terms of disease, the medieval ages can be regarded. You see, the plague of 1542. I did make a mistake here. Okay. Okay, so it was the bubonic plague in the 1348. Destroyed, took a lot of lives. Okay, it took a lot of lives. So, because sewage systems were not so good, I mean, outbreaks, rampant. Okay, so epidemics, okay, included leprosy, smallpox, tuberculosis, scabies, anthrax, all of them, and isolations of persons, with communicable disease were done. That was medieval Europe. So you can see the nature of this. I know a town in Ghana now that is like this. It's not even in Ghana, in Accra, but I don't want to put myself in trouble, so I will not go anywhere. But you look at it, you will know the time. So you see that it is there. So you can open your window of your room. You can open your window and you'll be seeing someone's room. You would have entered into someone's room. I'll tell you. Okay, there are towns in Ghana like that. Okay, I don't want to mention them before I'm called to Supreme Court to answer for myself. So that was how it is. Okay, that was how it is. I mean, someone where someone keeps his sheep or goats, or this one was the backyard of someone's bedroom. So you understand the scent, especially when you are rearing pigs, the scent that they bring, you know. In fact, if your house is there, then you know that you soon get fat from inhalation of things. Okay, so that was how it is in medieval Europe. Okay, then we came to the middle. So we say that during the Middle Ages, a number of first steps in public health were made in an attempt to cope. Okay. Some people say, Mr. Chambo says some parts in Nima. Me, I have not said anything. So because nowadays, IP address, they say IP address is can show where I am. I don't want any IP person to come for me with my IP address. Okay, so so that is how it was. So quarantining were done to limit the spread. Establishment of hospitals now came, provision of medical care and social assistance, and all of them were incorporated. Okay, so in fact, cleanliness was a luxury few could afford. That is the plain truth. Cleanliness was a luxury few could afford. Okay, most people washed in cold water unless they were rich and could afford to have it heated. So in Ghana here, in Africa here, the sun shines. And look at Europe, especially when the snow and this one, the cold weather, and you don't have money to heat your homes or even your water. Okay, so what is going to happen? You will force yourself to bath with the cold water. Care is not taking 2 weeks. It will be your feet that you would have washed, even that, unless heaven descends before you are able. And this people's mindset, they have been able to give better. And we find some people today, water will only touch their feet during Hamatan. Water will only touch their feet. Their body is prohibited by law that water should not touch. It's not easy. Then we came to the later Middle Ages. Okay, in the later Middle Ages, we have growing awareness of the importance of hygiene, and municipal authorities were spending money on trying to keep their cities clean. So people began to see the linkages between death, filth, and and disease, and then things began changing. So these are some of the slums. Some of the slums that were there that time. Now, towns began to build public latrines. So if you want to do it, we just run there. Okay, sometimes the town will get one, so you know where it is. If you are in town and the thing is coming and you have to run like 5 minutes or 10 minutes to reach there, that is the reason why in some tribes in Ghana here, you don't really someone when you are on your way there. You, on your way there, you don't greet. Nowadays, it is in our rooms, it is in our houses. But during that time, it is somewhere, and the speedometer, you are going to get 160 kilometers per hour so that you reach there early. And even with that, the way your legs will be shaking, and all your body will be moving like that when you have not released the how it was. Okay, they began building public latrines. It is even there these days in some villages. Okay, it is there. Even in the cities, we still have some. Okay, so for example, London produce a excrement per day. Okay, so just eating wrong things and then doing their things rough, left, right, center, left, right, center. So they have to do something about it. First, they were putting them in their water bodies and all of that. The fish should be. It's a cycle like that. It wasn't easy. So the towns had bath houses. So we now created bath houses that you can go and then bath. If you don't have some in your house. In fact, that time, the living we are living today, you just have to thank God that we are them, because it is the luxury that was there for some people that time. It's not easy. So that is that for medieval Europe. So one of the things that by the Parliament of England in laws enacted. Okay, so this passed by Parliament after the Black Death in England. It says so much dung, a piece of garbage and entrails be cast and put into ditches, rivers, and outlets, that the air there is grown greatly corrupt, and many maladies and other intolerable diseases do daily happen. All they who do cast and lay all such annoyances, dung, garbages, entrails, and other ordure in ditches, rivers, waters, and other places aforesaid shall forfeit to our Lord the kingdom pounds. So if you are found putting garbage, sewage, everything in river bodies, then you are going to the king. Okay, so this was how bad the nation was, and today they look at us with disdain as if they never went through this stage. So that was it. Then we came to the Enlightenment era. Okay, and the focus was on disease prevalence. So during the Enlightenment era, it says at the time of the Enlightenment, the period between 1700 and 1850, a more scientific approach, as social values and democracy became key themes. Okay, so you are going to realize that, as the name suggests, enlightenment, their eyes began to open, and you will be like God, like Satan told Eve. So their eyes began to open, okay, and they were realizing the linkages between a lot of things. And during that time, scientific advances of the 16th, 17th centuries laid the foundations for anatomy and physiology. Okay, so these were the times that you will have the painter, Leonardo da Vinci's, and then this one, the Vesalius writings being held in high esteem. Okay, so observation and classification were made possible, the more precise recognition. So you can realize that the Enlightenment period came with a lot of things that came to be. Okay, So we are saying that some philanthropists expressed concern about the health and welfare of their workers. So that's occupational health came into play and all blah 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 blah. So sepsis too was observed to be much more prevalent in medical student ward. Okay, so you know sepsis. Who knows sepsis? I know there are practitioners amongst us. Who knows sepsis? Okay, never mind. So we'll talk about it. So, in a medical school, they go and because they were not gloves that time. I mean, they were using their bare hands. So they go and see cadavers, they cut cars. When they finish, then they come and then begin to administer treatment to healthy people who are in the facilities. Okay. And when that thing happens, yes,
Yes. You asked what sepsis was. I think it's an infection that you build up of pus and white blood cells in tissues because of infection. Is that it?
yeah,
Okay.
yeah. So it's predominantly in the blood, and we'll come there when we reach pathology too. So so sepsis was there when the students go and then they hold dead bodies. They come straight and then they see patients and realize that there were some infections all over. You could see why are patients dying like that and all of them. So this was the concept that brought about the hand washing techniques. I mean, they realized that there was a direct correlation between the students going to the autopsies and then the administration of treatment after they have come there. So they brought in hand washing techniques and all of them. Okay. So yes, the results from poor sanitation and all of them play a role. Yes, that's true. So medical students were instructed to wash their hands in chlorinated soap, just as we have said. And then this man in 1842, Sir Edwin Chadwick, was able to prove that life expectancy was much lower in towns than in countryside. Okay, so to be able to live to an expected age, you were more likely to reach there when you are in a village than you are in the city. That was Sir Edwin Chadwick. And until today, that statement is still true. Those who are in the villages, typical villages, they tend to live longer and in better health than those in the cities. Okay. So he was instrumental in the development of central public health administration. Then we have come to the modern era, 20th century. The 20th century brought in a lot of infectious diseases, measles, diphtheria, smallpox, pertussis. Okay, all these came into play. The development of vaccines dramatically influenced. So now we are not seeing a lot of those diseases again. I mean, first polio was there, tuberculosis, but now because of the development of vaccines, these things have really gone down. Now, interestingly, the world is not battling infectious diseases again. What we are battling with now is lifestyle diseases. Lifestyle diseases. First, respiratory infections, they were rampant because the bacterial infection will infiltrate and then this. But today, as I speak, cardiovascular conditions, hypertension, heart attack, atherosclerosis. So these things are now and these are all lifestyle. And infectious diseases are really on the down. Now we have a lot of things, even in herbal medicine. When it comes to herbal medicine, the excellent work that many of our leaders have done and have brought out, solutions to scientifically that we can prove. It's not easy. Now, like infectious disease and we are gone, but now lifestyle diseases is not the problem. It's not the problem these days. Okay, so we are hoping to see a change. Okay, so in Europe, there were various movements. In Northern Europe, the Industrial Revolution in the late 18th century in Britain resulted in massive changes in population patterns and in fiscal environment. Nowadays, even in Africa, now when you're going to buy a land, the land is already there. We have real estate developers who have gone to buy, and they have demarcated the land. The lanes are really, really marketed. So nowadays, in the settlement, a time to come, it will be fine. When we all get money and build our own homes, I mean, the demands are fine. We shall there as their children are coming up, as they are passing away. A time will come, this land they will break all and then put better structures there. It's just a matter of time. Okay, so that is it. Then we came to the enactment of Public Health Act of 1848, all in Europe. Okay, so it established a general board of health to furnish guidance and aid in sanitary matters to local authorities and all of them. Okay, so some of the public health acts were to regulate sewage and refuse disposal, the housing of animals, how it should be done, water supply, prevention and control of disease. All these things were part of the enactment. Okay, so this is this one from 19th century to the medieval medical era, 20th century became the 21st, and now 21st century there we are organ now. 21st century we are organ now. Now we know a lot of things. It's just that we don't want to do. We know a lot, but we just want to refuse to, as if we have not heard it. At this point, any question for me? I've come to the end of today's lecture. Yes, so that is it. I'll share the slides. Yes, Mr. Henry, I think it's Pastor Henry there. Yes.
Yeah. Good afternoon to you and then to my colleagues. There is this saying that today health has really improved compared to the olden days, and they really talk about this against that of Africans. The Africans some time ago were really dying. But when we talk about they living natural, I mean, with eating very well and all, some used to say that wasn't the issue. But they were really dying more than today. Today's, I mean, more than today. Let me put it down. And I want to find out: is it actually the truth? Is it how it is, or along the line we all had? I mean, there was issues that all were dying, but not actually some were really dying. Thank you.
Okay. Yeah, so some of the things they say is exaggerated. We all understand that there were tropical diseases. Okay. At first, when you make mention of the name malaria, when you make mention of the name malaria, you would have to run away. Okay, you have to run away. But today we have a lot of treatment options. Gone are the days during that period, infectious diseases was really, really rampant, and it was not only in Africa. They were also having their share. You get it? They were also having their share. And as to whether we're dying plenty, yes, it is true that infectious diseases were really taking our forefathers. was infectious, it was real. But since there are no data to compare, I am restricted to say that it is true or not. Okay. But one thing is certain. Today, the data is there, and it is clear that we are dying today from lifestyle diseases more than infectious diseases as it is today. Okay, as it is today. Cardiovascular and then respiratory diseases are on top of the scale now. Okay, so it is true that infectious disease was this one, but I mean, there's no data. Africa, we don't keep data for us to really know. But the one thing we can say is that the life expectancy of our parents, even if the data is not there, I came to meet my great grandmother. You see, all these things are there. We saw them growing very old before they died. Today, obituary 60, 50, 40, and all of them. So we can do that comparison individually and say it may not necessarily be the case.